All righty. Good morning and afternoon. My name is Josh Schreiner. I'm the Chief Product Officer at HealthEZ. We appreciate you taking a few minutes out of your busy days to learn about some new solutions that we rolled out in 2024, as well as some upcoming products that will be available to your customers later this year. Just as a reminder for those that haven't talked with me or HealthEZ in a little while, we have three pillars when we think about the products and solutions that we are able to help bring to market for our consultants and employer partners. And they're focused around the HealthEZ experience, cost containment, as well as cost predictability with our level funded solution, Easy Funding. So just a reminder and what you'll see throughout today's presentation, the big differentiator for HealthEZ is that we have our own in-house care advocacy and navigation team. Our team is located here in Bloomington, Minnesota, and they really are the central key that ties everything together from the experience to our cost containment solutions. All employers that work with HealthEZ do have access. Our team is able to help members schedule appointments, shop for care, seek second opinions, as well as help triage and get them into any products or programs that their employer may offer as part of their benefits package. But that care advocacy and navigation, tying all of this together is what really differentiates HealthEZ from others in the market. So last year, actually probably 2 years ago, I think we could all see that there was a continuation of rising drug costs. So HealthEZ has been at the forefront of providing alternative funding arrangements, specialty drug carve-outs on the pharmacy benefit side. And in early 2024, we actually took those solutions and created a new program that actually targets high-cost infusion medications. So this is a program under the product name MECO, Medical Infusion Carve-Out, that targets 275 high-cost infusions. So these are medications that are administered by a medical professional in either a hospital, clinic, or home setting. This program works by focusing on three savings levers that can dramatically reduce your plan's spend on any of these high-cost medications. So the first is working to see if a member is eligible for manufacturer's assistance. If a member does meet the financial criteria of a program under that, the medication would actually be free, both to the member as well as to the plan, less a 30% of savings fee. If that's not successful, the second lever as part of our infusion carve-out program is our specialty pharmacy being able to dispense the medication directly to the hospital or provider or home setting. And the benefit of this solution is that it eliminates all of the expensive markup that I think we all have seen hit our employers. And then last, if the specialty pharmacy or the provider can't agree on dispensing the drug, we have the ability to negotiate a single case agreement where we'll reimburse the provider at anywhere from 100% to 125% of the cost of their medication. This program is available nationwide with all networks. And what's very unique about it is that our care advocacy team manages both the member experience as well as the provider experience in focusing on reducing the drug costs. Many of you might have been presented this last year as part of your employer's renewal. One thing that we really want to focus on today is having this in as a defensive mechanism. So the way that the program works is it's really centered around the prior authorization process and implementing this prior to having members with a potential high-cost medication. We continue to see on our book of business that oncology spend is the number one area of growing cost for employers, and waiting to plug this program in until you have an actual member that needs to use it can have negative financial impacts to your plan. So we'll give you an example. We had an employer last year who chose not to implement the infusion carve-out program because they didn't have any active participants with this that were on a medication that would have been eligible under this solution. What ended up happening is about 60 days later, they did have a member that was diagnosed and needed a combination of chemotherapy drugs. Because this program wasn't in place and it takes 60 days to go live from signing of a contract, we missed 90 days of treatment being able to reduce the cost. So the employer ended up spending about $225,000 on that patient's infusion costs through the HealthEZ medical infusion carve out. Had it been in place, it would have been reduced to 25,000. So they paid almost 10 times what they should have paid because they didn't have this program in a defensive or preventative position. We are actively talking about these solutions today. We believe that putting in these programs in the middle of your plan year is actually a very good idea. And it's for two reasons. Number one, it allows you to put it in place before you need it. And secondly, it allows you as the consultant or the employer to educate your members about this one individual program in the middle of the year instead of having to wait until open enrollment when employees are drinking from the proverbial fire hose on all the different benefits that they have renewing. So we think adding HealthEZ's Miko product for 5/1, May 1st, is a great option to put it in a preventative way while also ensuring that there's communication and understanding by your employees about this benefit. Next, we have another super exciting.
I'm sorry, Josh. I'm
yeah.
sorry to interrupt you. I just want to make sure. I don't think I heard you say that there's no cost unless they're using the service.
Thank you. So another great advantage of the Miko product is there is no fixed fee or PEPM. So you can add it and you only pay if we are able to deliver the savings and you have an actual member who is eligible. So there's no reason not to add it from a preventative standpoint and mid-year. So next up, we launched in 2024 a fully integrated surgery and imaging benefit. So this program is a nationwide solution that can be added to employers' health plan, and it provides three key benefits. Number one is it provides you with access to a set of hospitals, ambulatory surgery centers, and freestanding imaging sites of care nationwide that are reimbursed at 130% of Medicare on average. This is a fully contracted network, so it is not reference-based pricing. So when your employees use this benefit, they're going to a contracted provider. And the benefit to the member is that there is no cost share if they're on a copay plan. So if they use this special network for surgery and imaging needs, they pay nothing out of pocket. If they are on a high deductible plan, they just pay the minimum IRS deductible. So once they've met $1,650, any services through this bundle would be free to the plan participant, saving them potentially thousands of dollars. So this program has over 400 different procedures that are available, as well as MRI, CT, and PET scans. So just to give you a couple of pieces of data on the type of savings you can see from this program, on average, PPO networks reimburse these types of services anywhere from 220 to 260% of Medicare. So on average, having a member use this benefit will reduce your costs as a plan sponsor by about 50%. Our care advocacy and navigation is completely intertwined with this program. A couple of additional integrated benefits by purchasing this product through HealthEZ. in comparison to market competitor solutions is number one, we don't require any prepayment. So if you've heard of solutions that have cash pay or that you have to prepay so that you can get that discount, with HealthEZ's solution, it operates just like any other provider or medical claim, where we receive a claim from the member's provider after the services have been rendered. It goes through the normal funding channels, and you pay it right out of your medical claims account like any other medical expense. This provides a couple of additional benefits to you as the plan sponsor. HealthEZ is doing all of the payment for you, so you only have to fund one partner instead of potentially having to fund this outside of your third-party administrator. Number two, it's fully integrated into our stop loss filing as well as our claim and stop loss reporting. So it's fully integrated as part of your medical plan while giving members access to a benefit that is free to them on a copay plan or significantly reduced on a high deductible health plan. This program currently is $6 per employee per month. And the average ROI in the first year of having this program is 7-1. Your dedicated account executive will be sending you information after this presentation that will give you your customers' anticipated savings by plugging in this program. We also believe this is another great solution to add mid-year. So we are pushing to have this be considered as a product add-on effective as early as May 1st. And again, what that does is it allows our team and your team to focus with your employees on this one new benefit that can help reduce their costs and reduce your costs as the employer. All righty. And next, but certainly not least, is we do have a new solution. So if your employers are using Prime Therapeutics, we have a $0 specialty program. And this program focuses around international sourcing or personal importation of high-cost specialty medications. So this product can be added as well for May 1st. And the program has no fixed PEPM fee. You only pay if somebody actually uses the program. This product allows for medications, both self-injectable as well as normal pill form medications. 99% of the drugs are imported from Canada, with 1% of the medications coming from the United Kingdom or Switzerland. All of these medications are in English packaging and look exactly like you would expect if it was shipped from a pharmacy here domestically in the United States. So this program, again, no fixed PEPM. It, on average, will reduce the cost of your specialty drugs when a member uses it by about 50% over using a traditional PBM program with rebates. This program is fully voluntary, so members are not required to use it. It is just an additional advantage that if a member is willing to enroll in the program, no matter their plan design, they are able to get the medication for free so that they don't have any sort of an out-of-pocket. So this program is available through Prime Therapeutics. So if that is your PBM, this can be turned on as well as early as May 1st. It's a seamless enrollment. Our care advocacy and navigation team helps walk the member through the process so that they understand what they need to do, as well as working with the physician to get the prescription. And the member, if they do enroll, is able to get the medication on a 90-day supply. So instead of only getting it for 30 days, they can get a 90-day supply shipped directly to their home every quarter. And again, the member doesn't pay anything out of pocket, and it reduces the plan's costs by up to 50%. So if you're interested in this, your dedicated account executive will also have savings on the type of reduction in pharmacy spend you can have by adding this program. Alrighty, so we've talked a lot today. Again, we think it makes a lot of sense to add these types of solutions mid-year so that you can get your employees dedicated time to focus on one benefit so that you can increase the adoption and see the savings for your plan. So any of the products that we've talked about in the last 20 minutes, we can have installed as early as May 1st, as long as we have customer intent by March 7th and agreements executed by March 14th. So these are great ways to reduce your pharmacy, medical infusion, or your surgery and imaging costs as a plan sponsor. And any employer that works with HealthEZ is eligible to add these products as early as May 1st.
And I just wanted to add, Josh, that you'd mentioned that we usually have 60 days, and you'll see, folks, this is 45 days. We've gotten an exception so that we could offer this to you, to offer to your clients off renewal, and have a shorter implementation timeframe. So.
Yep. Our goal and our focus is for you all to have a great experience and also to deliver plan savings this year in 2025 and focus on that member engagement to increase adoption. All righty. So upcoming, you'll see emails from us in the next day or so on our exclusive webinar on March 4th. We are introducing a new pharmacy benefit product called EasyRx. So that will be available for new customers to purchase starting as soon as June 1st effective dates. But that is a program that is focused around transparency and reducing high dollar pharmacy claims by up to 50%. So be on the lookout for that webinar. Again, that'll be March 4th at 11 a.m. Central Standard Time. Myself and Jeff Bakke will be here to go over the product as well as answer any questions you may have on our new pharmacy benefit solution. And then later in March, so March 18th, we will have another exclusive webinar. We are launching a new product called Precision Pricing that we believe is designed to meet what a lot of our employers are really frustrated about with our current healthcare system, which is continuing to increase premiums and medical costs. So we have a new program, Precision Pricing, that fits within our cost containment wheel. And specifically, it's a new discount methodology that can provide up to 20% reduction in claim spend in comparison to a traditional PPO plan. So we'll have a exclusive webinar on March 18th where we'll go over that product and answer any questions. That solution will be available for effective dates starting July 1st of this year. So we have a lot going on at HealthEZ. We wanted to make you aware of some of the things we launched last year that we believe can deliver both a great member experience as well as cost savings. And then we have a couple of new solutions that are rolling out here in the next couple of months that we believe can help you and your employers reduce both pharmacy and medical spend. As always, make life easy. If you have any questions, please do not hesitate to reach out to your dedicated account exec or sales rep. You can also send any questions to the marketing email that was included in the invitation to this webinar, and we'll be happy to answer any questions that arise out of this webinar. So as always, we want to be respectful of your time and thank you so much for the opportunity, and we appreciate the partnership.
Thank you. Bye, everyone.